Wheeze is the whistling noise what you hear when a child breathes. Basically, it happens because of the lower airway narrowing. So if you take an infant, for example, so in infancy the wheeze is caused by some anatomical abnormality like tracheoesophageal fistula or a mass pressing on the bronchus, or rarely even a bronchomalacia. But the same thing, if you hear a wheeze in a child, then it is commonly due to infections. So usually it's a viral infection, but can also be bacterial infection like pneumonia. And if you see a wheeze in an infant in between childhood and newborn period, then commonly it can be because of obstruction of the airway. So obstruction can be because of the foreign body, like choking. Child swallows a small foreign body and then it chokes the airway and then we hear a wheeze. Or it can be because of a congenital heart disease whereby there is fluid accumulation and that causes wheeze as well. If you go to an older age group like childhood to older adolescent children, then the wheeze is commonly caused by, apart from infection, mainly allergy, which we call as hyperreactive airway disease or asthma. Rarely wheeze can also be secondary to some serious diseases like malignancies, whereby the pressure is coming from outside the airways and pressing the airways causing the wheeze. The treatment ranges usually from simple use of inhalers in case of asthma or a hyperreactive airway disease, or avoiding the allergen like in food allergy, complicated treatment like treating the cause which is causing the wheeze mainly. Like for example, if it's an anatomical abnormality, the abnormality needs correction, or if it's a mass pressing on the airway, the mass needs removal, or a foreign body choking the airway, then the foreign body needs removal through bronchoscopy. Why I want to highlight about this wheezing is, every child who wheezes is not an asthmatic or is not because of allergic bronchitis. So we have plenty of causes which causes wheezing, and unless we identify all the causes and treat them appropriately, the child is not going to get better.